Today we are discussing a very important and relevant topic is Ayurveda, a pseudoscience. Some people strongly believe in it while others question its scientific validity.
It's not often called, right now it is called as pseudoscience. We have a history of 5000 years back. Even treatment for cataract, surgical procedures for cataract, you can find even rhinoplasty also. Ashtanga means 8 branches of Ayurveda. Kashyapa is the best for pediatric. From the day of birth to the teenage. And we have our own immunization schedule also. Modern medicine, that is the issue actually. Some people may find that Ayurveda is slow. Ayurveda don't have any side effects. If you are getting some good treatment, if it go for another 2 to 3 days of extended therapy or medication, what is harm in it? Yoga is accepted, means yoga is just 10% of Ayurveda.
Namaste sir, welcome to our podcast. Today we are discussing a very important and relevant topic is Ayurveda, a pseudoscience. In recent times there have been a lot of debate around Ayurveda. Some people strongly believe in it while others question its scientific validity. So today we want to understand this topic from a clinical and practical perspective from Ayurvedic doctors. So Dr. Jagadeesh sir, thank you for joining us. Let's begin.
Namaste. Myself, Dr. Jagadhish Nayaka. I have studied my BMS from Government Ayurvedic Medical College, Bangalore, and I did my MDs in JSS Ayurvedic University. Right now, I am practicing in Mysore. I am treating spine, joint, and neuro-related disorders much more. So, today's it's my pleasure.
Sir, Ayurveda is often called a pseudoscience. Is this criticism valid or is it a misunderstanding?
The question itself only, it's not often called. Right now, it is called as pseudoscience. I will tell you. The world has accepted Ayurveda from so many years back only. We have a history of 5000 years back. It might be in a different name in different countries, but still Ayurveda is a traditional system which practicing day-to-day life from the past, which is time-tested. So it is not oftenly called as pseudoscience. Right now it is called as pseudoscience because of some other backward science or any mafia or anything. You call it anything. You take it with any way of commercial side, or to demoralize the Ayurvedic practitioners, or to divert the Ayurvedic patients, or something in some angle it is affecting. So it is not often, it is right now. Okay, because of some, you can take it as a improper knowledge, or they don't want to know about what is Ayurveda, and what they know, that is called as superiority complex. So they often right now calling it as a pseudoscience, but it is not that. It is a proper science, and it is the mother of all science. We believe in it.
Sir, what actually defines something as science? By that definition, where does Ayurveda stand?
See, you know definition about science. I don't need to explain anything about science. That which is validated, time to time tested, and that is in proper practice. It is called science. That is beneficial for the human being. In medical field, the science is definition is different. In some other field, science will be different manner. See, in our medical field, that the system which is practicing still today, which is practicing yesterday also, and from the past it is timely tested, and the drugs are not in every generation it is not going to be changed, or the treatment pattern is not going to change for the disease purpose, and that valid system is called science according to myself. So you can go with an explanation. So I will tell you the definition of Ayurveda itself only. Ayu plus Veda, that means Ayu means life and Veda means a study of a science. Okay, the study of life science is called as Ayurveda. You can take it for in general sense. In a particular way, in Ayurveda, it has some purpose. That means to treat a diseased person and to maintain a health. That is called Ayurvedic science basic fundamentals. Okay, this is a definition of Ayurveda.
Yes, sir.
And we have a clear-cut definition for health also. It goes like this way. Sama dosha means we have Vata, Pitta, Kapha. There is a basic fundamental words for explaining the nature of the body. Okay, and Vata has its own types and its elaborated definition, and which the way of functioning, principles, everything is different. Even Pitta and Kapha also same. It's not that Vata means a gas or Pitta means a fire. It's not in a layman language, it is not like that. we have a proper definition why it is called vata, why it is called pitta, how many types of vata are there, and each and every vata where it is placement and what that action has been, and if it is altered what the disease may arise, everything is there. That is vata, pitta, kapha. That is samadosha, means that should be in equilibrium manner. And the dhatu means tissue. Tissue means we have rasa, rakta, mamsa, meda, asti, majja, like so on. It can be explained in modern way, but I don't want to correlate with the same terminology to the modern, because their fundamental principles and their definition is totally different.
Yes.
Okay, if it is understand, you can take it as a dhatu means the tissues. Okay, that should be in a proper developmental state. And mala means that excreted product should be excreted from the body time to timely.
Yes.
Okay, that there are several excretors are there, and even sweat, fecal matter, urine output, and even mucus secretion from nasal cavity or oral cavity. That should be that is all called mala. Okay, and indriya means sense organs. That should be in a balanced way. Okay, each and every indriyas has its own action. Indriya means sense organs. That should be work in a proper way. Okay, and prasanna atma means the blissful mind should be there. Okay, so these all merged in a person who has the person who has everything in a equilibrium manner. It is called as swasthya. This is the definition of health in Ayurveda. Okay, it is not merely a disease-free body is a health, or after 5 years, not just merely disease-free and it's physically fit, and after 5 years even plus add it on psychologically well-being, and next again the addition has been done, and it is been taken for not only disease-free, mentally physically fit, mentally and socially and spiritually well-being. It's all been edited in recent what you call modern health definition. In our science, it has been elaborately explained what is health. These two are the basic fundamental things we can explain that this is not a pseudoscience. I can elaborate with a little bit. These are one the definition of health and Ayurveda has been done. Okay, I will go through some other points which is validated that Ayurveda is not a pseudoscience. Let me tell you, we have anatomy which is Sharira Rachana, we call it. For that, Shushruta is a best text for that actually. He has written everything about Sharira Rachana, means anatomical structures. Even he has explained the skin layers, okay, how much thickness it is there and how many layers are there. Next, above the next, what are the layers? He has explained in Sanskrit words, okay. And even he has explained how many types of bones and total number of bones, how many teeth are there in a teenage, below in children's, and after teenage adult, the number of teeth are being explained in detail. Okay, this is a valid statement that Shushruta has everything has been mentioned in his.
He is also called as father of surgery.
It's why worldwide it is accepted
Yes,
that
sir.
he is known to be a father of surgery. See, the word surgery, why it is been coined before, why he is called as father of surgery? Because in Sushruta Samhita is explained as surgical procedures, surgical instruments, and type of bandaging, and even related to ortho, that how to be fracture should be handled. Everything is explained. Sushruta is meant for surgery, surgical process in upper hand compared to other samhitas, okay, other scholars. And even Sushruta has explained that even treatment for cataract and what is surgical procedures for cataract to be done if it is not in a treatable condition. And you can somewhere else you can find even rhinoplasty also, where Sushruta has performed. It is documented. I am not saying with any exaggerated things so that you can call it pseudoscience. It is documented. If you open a Sushruta Samhita, you can find the things written and documented. It is not in a particular pattern because at that time they found it should be added in this chapter and next to be another chapter. Right now we are following the pattern that is not there in the previous pattern. They are understood in some different pattern. They have said it somewhere else. Rhinoplasty, somewhere else cataract, somewhere else anatomical structure, somewhere else bone numbers and everything else. It is scattered here and there, and we don't have original script also. What we got it is all damaged script. Okay, that is in extinct position we got it. Even leave it about Sushruta. Let's go about next another classical scholar. There is another scholar, another text is called Madhava Nidana. He is known to be famous for diseases prognosis and its types or classification and what kind of diseases at that era he has mentioned. almost more than 250 or 300 diseases have been mentioned in Madhava Nidana. Signs and symptoms, the prognosis, and even treatment also been mentioned. But Madhava Nidana is famous only for disease-wise. Okay, this is also documented. Okay, this is anatomy has been done, and disease signs and symptoms prognosis has been done, and next for treatment aspect, we call it Charaka Samhita is a upper hand for the treatment. Okay, that is called Shushruta Sharira Shrestha, Madhavan Rogi Shrestha, and Charaka for Aushadha Chikitsa. Okay, so if you consider for Charaka Samhita, he has elaborately explained so many treatment for so many diseases. He has classified Kashaya based, Churna based, tablet based, means we call Vati, and Varti based, and he has gone such an extent that he has explained 3 Vadis also. How many types of Vadis are there in female, and after delivery what the major diseases been encountered, and even before puberty, after puberty, the puberty signs and puberty lakshanas, symptoms, everything has been explained. Adolescence nature, everything has been explained by Charaka also. See, this is about the Charaka Samhita. Okay, this is about the Shushruta Samhita and Madhava. Only 3 of them I have taken you. Okay, there are a lot of things. We have Ashtangas. Ashtanga means 8 branches of Ayurveda. Okay, then lot of things have been explained about Kaumara Britya. Kaumara means pediatric. We got to know that Kashyapa is the best for pediatric. He explained from the day of birth to the teenage, what are the diseases to be encountered and what the nature of the baby should be taken care. Everything has been explained in Kashyapa Samhita. And we have our own immunization schedule also. That is called Swarnabindus Prashana. It is a best samskara actually. And what procedures to be done in a first week, second week, first month, second month, third month. It has been elaborately explained. Even such an extent they went that Karna ear piercing, the procedure has been explained when to be done and how to be done. Okay, and even Anna Prashana means the baby, when the baby should be feeded with the Anna means rice. Okay, how much and what the consistency should be, he has explained. Still that how baby should be there. Kshirada if they call it, means only they should be fed with the milk, breast milk or goat milk or cow milk. It is clearly cutly explained. Okay, and selection of milk if the mother is not there, that is also there explained. Okay, these all things are being detailedly explained about Kaumara. Okay, after that Kaumara will go about toxicology. Right now it is a heat debate. No, Ayurveda call it Ayurveda medicines are being toxic, have lead toxic, mercury toxic. And see, myself I have done Rasha Shastra. Okay, that is one of the branch in Ayurveda where Rasha Shastra deals with herbo-mineral preparation.
Yes, sir.
The preparation of medicines and its executing with the patients and testing in a lab and clinical way. Both are done in Ayurvedic Rasha Shastra. We being a Rasha Shastra student, we have seen so many, more than 1,000, 2,000 scriptures books are there in Rasha Shastra itself only. Okay, Rasha Shastra, we are excellently and we thoroughly know about which drug is toxic, which drug is not a toxic, and in which manner it should be purified and how much quantity should be used, which medicines to be used as a single drug and which medicine should be used as a multiple herbo-mineral preparation. We have lot of pharmaceuticals. We have liquid, that is Kashaya. We have powder form, that is Churna. We have tablet form, that is Vati. We have Lepa, that is external application, that ointment or oils. We have lot of clinical pharmaceuticals we have. Okay, this much of elaborately explained in Rasha Shastra. Even we are best in handling mercury after purification, that is called Shodhana, and we convert that into a absorbable form which is not toxic to the body. Okay, and some other medicines are there where only herbo-mineral preparation, okay, the combination will act as a fine, and some other medicines are there only herbal, only pure mercurial product or Rasha Shastra product will help for the patient. That is called Basma, we call as a Basma. We have a test for Basma also. The Lakshana of Basma, why it is called Basma, and what stage it is called as completed the procedure, and what are the examination. So in olden eras, we have some, today they may call it as a primitive test, but still it exists. Okay, we have Rekapurnata test, okay, and we have a Nirduma Pariksha, and we have Varitara Pariksha, and so many tests are there. After the test has been passed, then only we are going to use for clinically. Otherwise, we will not use it for clinically. Okay, if something has gone wrong and we are using and we encounter with toxicity, what to be done? That is also been explained.
Yes.
If patient encounter with some side effects with using this much of this dosage, what to be done? That is also been explained in our classical text references. Okay, this is about Rasa Shastra. Okay, this is only for mineral preparation, herbal mineral preparation I explained. There is another one branch is there, Dravya Guna. Where Dravya Guna only deals with the explanation of plant morphology and its action and what nature we can use it and what are the things to be taken from the tree or plant. Okay, whether it is a bark, is a leaf, as a flower, seed, or a root or a stem, each and everything has been explained detailedly. Each and every plant has its own morphological structural explanation in Dravya Guna. Okay, its drug mode of action and which disease it should be used with the multiple drugs, choice of drugs. Everything has been explained in Dravya Guna. Okay, this is about herbal preparation. Previously, what I said about mineral herbal preparation. Okay, there is another branch which is called as a Stri Prasuti. Okay, there it's detailedly explained. We have a classical reference here and there like Charaka, Shushruta, which has been scattered, which has been compiled in a particular book, and we are studying all those things in our syllabus. Okay, each and every things we are studying about Stri means obstetrics and gynecology, what they are teaching, the same thing, but we are right now its modern syllabus also been added to our syllabus. Okay, but when we compare with the modern syllabus and our classical Ayurvedic, so the symptoms are same. There is no difference right now and that past symptoms. Okay, literature, whatever the literature has said it, it's existing today, and that same disease means showing same symptoms. Okay, this is about Stri Prasuti, and we have our Ayurveda extend to such a stage that we have geriatric treatment.
Yes, sir.
Okay, that is Rasayana and Vajikarna Rasayana treatment and Rishya Chikitsa. This all there. Rasayana is an antioxidant, you can call it, but I don't want to compare with the modern terminologies. Rasayana Chikitsa, where a person can emerge as a healthy way. Okay, that nature has been explained in our Rasayana Chikitsa. Okay, and about Vajikarna, that is aphrodisiac. Okay, in aphrodisiac, sexual problem disorders, everything has been explained. How many type of sexual disorders are there? Right now, what they are encountering sexual disorder, not that way. In olden era, what they have encountered, they have explained everything else. And what is the treatment for? Infertility has been explained in there. If male infertility, female infertility, everything is detailedly explained in Vajikarna Chikitsa. And Rishya, geriatric treatment. Old age, what is the care should be taken, and the way of lifestyle, what should be there. Everything is explained in Rishya for geriatric person. Okay, there is another branch called Swasthruta. Swasthruta means today you can compare it with preventive social community medicines and social medicine, preventive what do you call it? That one. In Swasthruta, a hygienic has been explained. Not only external hygienic, internal hygienic, the cleansing of our body. Okay, not only the human hygienic and surrounding hygienic, how should be there. Okay, and a village, how should be hygienic. In a pond or river or well, how should water should be maintained hygienic, and what are the method of way of lifestyle. From early morning, the person wake up and to the bed, what are its rituals should be followed.
Yes,
each and everything has been explained. At what time he has to eat, what time he has to drink water or milk or anything
and
else.
how it has
And
been
even it has explained clearly when we need to have sexual contact with a woman, when not to have a sexual contact with a woman, and what age after maturity we can have a child from a lady. Everything has been detailedly explained in Swasthruta.
even yoga
Okay.
has been
This much of explanation are there. If I keep on going explaining each and every brand, it will take complete one day for me to explain. Okay, these all literatures, these all my explanation. Do you think this validation suits that Ayurveda is pseudoscience? I can explain you in better way. Some things are not suitable for modern era, but not that if it doesn't fit in that cup of tea, it should not be called as pseudoscience. This much of explainable, this much of knowledge was carried from hand to hand without any data storage material, without any institution. We are keep on hand to hand how it is been passed from generation to generation, only through oral, verbal, or some palm leaf structure. If we today, those who are questioning about Ayurveda is pseudoscience, if our Shushruta, our
Acharya.
Acharyas well know that tomorrow they might be questioning like so, they would have scripted in some other stone carvings or something else. See, it's not important that it was verbally passed to generation. Do you think after this explanation you call it as Ayurveda pseudoscience?
Yes.
Okay.
Ayurveda has a long history, but tradition alone make it scientifically valid?
See, Ayurveda has a lot of long history. Even some historians are just guessing it. Okay, how old our Sushruta and Charaka Samhita are. Okay, see, it is a time tested. Ayurveda is called one of the Upaveda of a Veda, and we not able to guess the age of Veda exactly. Some historians have quoted it. Okay, you consider least on list. Consider for 200 or 300 old history. We have documented everything. We explained everything. Even if you consider 300 history of past, we are very much sound in so many things about documentation, about explanation of a disease, everything whatever I explained right now, we have documented it. Even 300, leave about 300, 100 years before, what they today present modern science, what is not evolved at all. It was in testing mode and trial mode. It's in a just a baby mode. Okay, we are that in that stage when modern science was just evolving. We have explained about rhinoplasty, cataract surgery, and everything. But the worst thing happened. What happened with Ayurveda? I will tell you. In generation wise, or in some particular history, Ayurveda has been suppressed by so many persons with so many reasons. Okay, we don't want to go with that clash actually, but Ayurveda has been suppressed. Surgery was been suppressed in Buddhist era. Okay, and in Mughal era, that medicines and way of treatment was been suppressed. Some medicines and some disease was been translated to Unani or Urdu or something, and it is still practicing as a Unani medicine. Okay, so if you consider for minimum history, it has what I guess is more than 3000 back. You can take it on. Okay, this much of history Ayurveda has. So from still today, it is without any resistance, it is surviving and it is gaining a popularity just because of it has strong foundation and it has strong result orientation. For that purpose, still we are in 5G or 6G era, Ayurveda is sustaining and surviving, and it is excellently growing in all over the globe.
If Ayurveda works, why does it still struggle with acceptance in the modern scientific community?
See, Ayurveda has its own pattern of healing. Okay, it has its own way of treating a disease, observing a disease. So in that manner, okay, some people may feel it is actually Ayurveda result are very slow, but it is not like that. Actually, basic principle of Ayurveda is whether you treat a disease for certain time or period and whether it is get treated or not. While treating the process, we should not arise as any some other issues. Okay, that is our basic motto. That means you should not harm the patient while treating. Okay, present issue should be solved. Later on, some other issues may arise. Okay, in modern medicine, that is the issue actually. While treating a disease, they will go with some drug-induced side effects. It is not there in Ayurveda. That is a basic principle where some people may find that Ayurveda is slow. Well, see, if you are getting some good treatment, if it go for another 2 to 3 days of extended therapy or a medication, what is harm in it? Okay. Some sectors, especially in acute condition or in trauma, we are lacking. Where allopathies are good at it, they can approach that. No issue.
Sir, where do you think Ayurveda shows strong clinical results and where does it still need improvement?
See, clinical research and everything started just 40-50 years before only. And still that before we have documentation. Okay, and there was not there certain framework or certain principles for research activities in Ayurveda. Whatever the modern science has been following, we are also following that criteria. That is not suitable for Ayurvedic framework. Okay, Ayurveda has its own different models. Okay, for testing a drug and doing a research activities. If that has been adopted, we'll definitely give a validate statements and validation of research and everything else. Right now, it is time tested and clinically approved and clinically result oriented. This can be explained. This can be accepted. Okay.
Sir, do you think some practitioners or exaggerated claims are responsible for Ayurveda being labeled as pseudoscience?
See, that exaggeration just because business angle. commercial activity. So in commercial activity, they do advertisement with a star casting or some local stars. That is also called as exaggerated. Whether it is in Ayurveda or allopathy, that is for purely commercial. Okay, it doesn't mean that Ayurveda has no result and it is pseudoscience. We have some result-oriented medicines that is not been explained or that not been advertised.
Sir, how can we differentiate between genuine Ayurvedic practice and unscientific or commercial approaches?
See, right now it's government duty to make it on, because some act amendments and rules and regulations being adopted. There are some traditional healers are there, we respect them, but right now in present era, we need to be a degree holder. Ayurvedic doctor should practice Ayurveda. What is happening right now, any Swamiji or any yoga teacher or any who is father are treating, they are on the social media or they are in the news channels for treating. They claim that we can treat this and so and so. So this is what happening. But when Ayurvedic doctors, he is professionally degree qualified and he has done research and anything else, PG or PhD, if he treats, that is well and good. Okay, government is encouraging for these kind of activities, not for quacks or those who are claimed by orally, not with any scientific validation. There are some organization are there, FLRHT or some other, just I know only one organization. Okay, even CCRS, they go with the traditional healers, tribals, and they collect the data and they put it on research activity. If it is passed, they will also, that treatment protocol, everything has been identified in a book and they will publish the articles. Okay, yes. These kind of activities are going on from government side, but I will request society, you should have some idea about who is Ayurvedic doctor and how we find out he is Ayurvedic doctor. The rules and regulations clearly mention we need to put some certain degree certificates and KPM certificates in Karnataka. Everything should be there in rules and regulations. Before enter into clinic, if they assess those, they can get to know who is genuine and who is not genuine.
Should Ayurveda be validated through modern research methods or does it require a different framework?
See, that is what I explained previously. Ayurveda should be validated from its own framework only, not with the modern models of research activities. Some models are acceptable, okay, but few things are not acceptable. We are not fit into that framework. Okay, government should take care of everything else, and some research activity, research wing should be come up with such a model, so that research activity should be done in a PhD or in a PG level and in some research centers. After that, if it is validated, it should be published so that we can easily answer the society and some modern researchers also. Few things can be accepted from modern validity, few cannot be.
Sir, why does some patients does not get results with Ayurveda while others is significant improvement?
See, it is not from the angle of Ayurveda. It depends on purely about the doctor, the who is handling. Okay, how much he is knowledge oriented, how much he is experienced. Even in any branch of medicines, if you take it, there is a error, medical error is there. Result positive should be seen and negative should also be seen in every system. Okay, it doesn't mean that if you see some out of 100, 2 to 3 or negative, means that your system is also not a result oriented. It should not be labeled like such. Every science has its own merits and demerits. Every practitioner have its own negative point and a positive point. Okay, it is not a proper question. Each and every practitioner will face this thing. Okay, 100% successful practitioner is nowhere in India or nowhere in the world. That's why it is called practicing, day by day practicing. We are learning and we are improving, we are modifying ourselves in day-to-day practices.
Sir, can you share real clinical cases where Ayurveda has shown clear results?
See, if we are treating from so many decades and so many centuries and it is result oriented, that itself only validated that it is clinically tested and is clinically approved. Okay, right now if we need some modern research activity to be done, the framework and model should be prepared according to Ayurvedic basic principles. After that only result we can assess that it is whether, see, result might be negative and even positive. If it is negative also, that is also research activity. The hypothesis should not be always positive only. Okay, that activity should be done from the institution level and government level. Okay, we practitioner, we can practice, and we can, if something adverse drug reaction or something else we found out, we can note it on, we can put it on our organizations, so associations, or through to institution. It's their duty to take up the research activities, not with the practitioners.
Yes, sir. Sir, can Ayurveda and modern medicine complement with each other instead of being in opposition?
See, I strongly believe that integrated practice is always the best practice in anywhere in the world. Okay, integrated means not that from Ayurveda one person, allopathy from one person, Unani one person. It is not like that. Okay, the person who is practicing, he should have some knowledge about other system, other branches also, where that branch is superior in treating that disease. Okay, in acute condition, pain management, or in any trauma or blood, in blood oozing or some blood injuries or something fracture, they are best. Okay, in some allergic reactions or any epidemic disorders, they are best. We can adopt that kind of treatment with our Ayurvedic medicines in our practice. Definitely, it is the integrated practice, is the best practice in the world. There should not be conflict between allopathy, Ayurveda, Unani, homeopathy. Each and every doctor should, in the open broad way, that from this system, this medicine is good for this disorder. It is validated. It is clinically established. So let adopt it. That mentality should be there in each and every practitioner. It is called integrated. Integrated means not Ayurvedic doctors should adopt allopathy completely, or not allopathic doctors should adopt Ayurveda completely. They have to practice their own system. At least 20-30% of should be adopted from other branches of system. That is called integrated. This is the best way of practicing and best way of delivering health to the society. Okay, government should take care of all those things, because integrated practice, if we start doing in from rural area, the rural people will be disease free, definitely.
Yes, sir.
Okay, because their medical approach and their hand to hand equipments and everything will not be there in as compared to urban. If we adopt integrated practice in rural area, definitely the rural people will get benefited. Okay, this is my view of point.
Yes, sir. What role does research, documentation, and standardization play in strengthening Ayurveda?
See, that is what I explained actually. That standardization means standard operating procedure. It is there in pharmacy. It is a GMP, good manufacturing product. We are adopting it for manufacturing Ayurvedic product. Okay, and standardization of education, standardization of higher degrees and branches has been adopted already. Okay, in research activities, that standardization is there in Dravyaguda branch and in Rashastra branch. Some framework for clinical approach are not suitable for Ayurvedic system compared with the modern models. So we need to look on it. Okay, in coming days, definitely our CCRS will take care of those things, and with valid models, we will come up with research activities in coming days. See, hardly we are getting funds and we are getting research activity. Whatever the funding is there now, recently we are getting few of things. In compared to 50 years back, we are zero actually.
Yes, sir.
There is zero funding for Ayurvedic research activities. All of a suddenly in 30-40 years we should emerge out like a allopathic or modern science means it cannot. It take times to research our own way and to validate to the society.
Yes, sir.
Definitely in coming days it will be done, definitely. I hope so.
What responsibility do young Ayurvedic doctors have in presenting Ayurveda more scientifically?
See, they should believe first. Whatever they study, in whatever situation they come to Ayurveda, they should start accepting Ayurveda, should study Ayurveda, should present Ayurveda to the society in an understandable way. We should make them clear in our own languages what Ayurveda says. We should not translate it to the modern way. Okay, and pure elaborated way of Ayurveda explained in society is enough for the Ayurvedic students. Okay, if they adopt 100%, if they practice 100%, definitely younger generation can make anything else in upcoming days.
If someone says there is no scientific proof for Ayurveda, what would be your direct response?
See, in which branch they are expecting a proof means most probably they are expecting clinical. Okay, See, my grandfather was using telephone landline. My parents are using mobile, and I'm using smart mobile. See, these are generation wise how science is evolving and how lifestyle is evolving. Right now, they feel that Ayurveda is in a primitive stage. Okay, it is not result oriented, but compared to some other modern side effects or something else, Ayurveda still stands in a better position. Okay, in chronical disorders, we stands in a better position. Okay, in any kind of to avoid a age holding process, Ayurveda stands a better way. And in lifestyle management, Ayurveda stands a better way. Ayurveda has its own another branch called as yoga also, naturopathy also. Now it is bifurcated from Ayurveda for academical purpose. But the thing Ayurveda means it includes naturopathy and yoga also. That is naturopathy means prakriti chikitsa. Okay, yoga still you do yoga and you expect something. It is should be a those who are practicing yoga, they're living lifestyle and with a very peaceful manner. They are living healthy life. Okay.
Yoga is worldwide accepted, but Ayurveda is not that accepted.
Yoga is accepted means yoga is just 10% of Ayurveda. Okay, the 10% only accepted. When it is accepted, when some eminent yoga teacher was teaching that yoga to the foreigners abroad, they went out of India and they show what is yoga. Then only it is been popularized. From I think not more than 50 years. Okay, it has been popularizing. Okay, now it's a time for Ayurveda also to get popularized worldwide. WHO has accepted it's one of the medical system. Right now there are so many abroad researchers are taking research activities from our Ayurvedic concepts and our Ayurvedic drugs. Okay, this all when it come up with a modern tools, then they will accept Ayurveda is validated. See, one century before, we can't imagine that video call can be happened. We can't imagine that voice exchange from another place to another. Right? It is impossible because of researchers. Even that kind of research activities happened from Ayurvedic way. We can establish where their concept was there and how it is validated. In coming days, definitely, see, whoever may say something pseudo or something else, whoever may suppress. Ayurveda has seen so many person who is suppressing. Okay, from past, take it for 1,000 years before. Ayurveda has suppressed so many kings or so many dynasties or so many persons. But still today Ayurveda has emerged and it is developing global wide. So there is no issue. It will show it definitely result in coming days. Not more than 10, 15 years. Maximum 20 years, that Ayurveda will be in a global level. Definitely.
Is Ayurveda failing in communication, research, or practice? What is the biggest gap?
See, the literature what we right now having, it is incomplete literature. Means some chapters are missing out of that literature textbooks. Okay, and after that next generation they try to add up that to fulfill that gap actually. Okay, up to their level of knowledge they have fulfilled that gap. Okay, and right now it is been interrupting in a English translation. We are studying in English translation. When we start studying in English translation, that is the gap actually. When we study our science in one own language of mother tongue or Sanskrit or Hindi, we get to know what is that. From after PU, we are directly entering to the BMS course, where the person who has not took up a single Sanskrit word in his life is entering to the BMS means what can we expect? This is one gap. Another gap, the institutions are, they should be improve themselves. The institution should keep on every year they modify their education pattern, their clinical activities, their way of clinical approach, everything should be done. Otherwise, see, simply following a olden traditional means it doesn't. Modern tools and technology should be adopted. Then it should be fit into the Ayurvedic clinical practice. This gap we are finding out. And the main gap is fund. The fund or what we call budget from the government or some other investors, it is not there as comparatively worldwide in a modern. Okay, that is also one of the gap. And another thing, some crooked-minded people are demoralizing Ayurvedic practitioners and demoralizing the patient who taking Ayurvedic treatment. Even though he and his father or his parents are getting a good result, he may have some doubt because of it is called Gen Z. Okay, they themselves called Gen Z and they need to verify everything and need to validate everything. In that way, some people are influencing them. Okay, in influence, They may also treat Ayurveda as in a poor condition. They look into that poor condition. That is one of the gap. Okay, and even some, I will tell you frankly, those who are studied and practicing Ayurveda, they themselves are only not practicing pure Ayurveda. That few people are attracted to the modern practice, and they are adopting 100% modern. Adopting some of the modern medicines is not harmful, but 100% adopting to the modern medicines and practicing their day-to-day life is not a good thing. That is also one of the gap. And some institutions are taking up research activities on single herbal, multiple polyherbals or herbomineral. Say some institution has done research activity up to the level. BHO, Jain, Banaras University is there, and Jamnagar University is there. Even JSS University and STM University. They are taking care also some other institution. They are taking care of well-researched activities going on. Once it is come out of, when result is out, we'll get to know. Okay, that result is right now we are not showing that society, and society is not believing right now. That is one of the gap, I think so. If we fulfill all these gaps, we definitely win a global level.
Sir, what is one thing Ayurveda must change today to gain global acceptance?
So it is accepted globally. The thing, we need to go out of India and we need to show, practice. Some legal documentation should be required. That present government is taking care of it. Once we go out of the India and practice in some other countries, and we show what is Ayurveda, and there some result-oriented acceptance is there, and we validate that clinical activities, then definitely it is accepted. One thing I will tell you, in my practice, Ayurveda don't have any side effects.
Yes, sir.
In clinically. If you take it in a larger quantity, you may just have a vomiting or dysentery. That's it. Not a harm. I mean, not exactly dysentery, loose stools. Okay, but it's not a threatened. Okay, it's not a mortality. Okay, in any Ayurveda medicines, if you take it. Okay. So this is one thing we are having a stronger side, that it should accept from global side also. Globally, it should be accepted because we don't have side effects. Ayurveda has so many branches to treat a particular disease. The suitable the person who is not suitable with this way, we can treat it with some other way. If he is a old age, he cannot be adopted for Panchakarma. He can treat it with a geriatric rasayana. If he is an adult age, we can go with Panchakarma, Shodhana Chikitsa, that purification. Panchakarma means penta biodetoxification. If he is not fit for Panchakarma also, we can go with mineral preparation, herbal preparations. If that is also not there, we can go without therapy, medication. That is a therapy. That yoga therapy is there, or some other kind of upa therapies are there. We can do it. So there is a lot of option in Ayurveda. That should be accepted. That's it.
For a common person, how should they approach Ayurveda safely and practically?
That is what I said. Ayurveda is better safer compared to right now modern days what we are encountering. I will tell you one few things. Just 20 years back, we are not. It is renal failure is not a common disease. Okay, heart attack was not a common disease.
Yes, sir.
Okay, obesity was not a common disease. Okay, insomnia, sleepless disorders, or anxiety, stress, everything was not a common disorders. Okay, lifestyle and professional pressure, or any kind of pressure from the individual personal life or something else, or the way of food is having right now, adulterated food or something, or some kind of advertised food, okay, or some kind of oil we are using, everything matters right now. Okay, above that, the modern medicine is also affecting a human, okay, that lifespan or something else. It should be accepted. They have some good result in acute condition, but it should be accepted. It should also have some untoward side effect. Dolo 650 is a common thing. It was 500 mg paracetamol was affordable. Right now, past 500 mg, nobody is going to prescribe you. They are going up 650 mg or 800 mg. Some IV fluids, 1 gram of paracetamol is infusing. See, why it is? Because that dose is not working right now. What my grandfather was having the antibiotic, right now that antibiotic is not in a working condition. Okay, it don't have any kind of result. What my parents are using, that antibiotic is not working for my children. Okay, day to day antibiotics and medicines are increasing dose day by day. Okay, so in this kind of situation, Ayurveda is answering in a better way. Even though it may take 2 to 3 days of extended medication, it has zero side effects. Okay, then better thing what you are expecting. A person should be treated first without any side effect. That is there in Ayurveda. You can treat it with so many way of treatments. That is there in Ayurveda. If you don't want to take your medication, few chronic diseases can be treated with yoga. Some diseases can be treated with hydrotherapy, naturotherapy, mud therapy, everything else. See, each and every therapy has its own effects in particular disease. That depends on the practitioner. It doesn't mean that every system is a pseudoscience. Okay, this is the best answer for them. Those who can't believe Ayurveda or they want to know what is Ayurveda, this is the best answer. They don't have side effects, definitely. If you take it for extended therapeutic dose also, we don't find any side effects. If you take it for a prolonged medication, no side effects.
If some who's watching, they might ask, then give us the proof of your Ayurvedic works or something like that. Like, where can they access that?
Regarding therapy, treatment or classical references, there are a number of books are there. Even today is a AI world. Okay, you name it, that will you can get it. Okay, any kind of thing.
Research papers.
Anything you can. Even literature, books, research articles, and the traditional practitioner way of treating a everything you can get it in online. You can go through it. You can validate. Okay. Some exaggerated advertisements are there. Don't go behind with it. Purely go with the literature work. Okay. Some research activity work that is validated.
As we come to the end of this discussion, one thing becomes clear. Ayurveda is not just about treatment, but it's about understanding the health in a deeper and more holistic way. Whether one sees it as traditional knowledge or science, what truly matters is its clinical application, patient outcomes, and responsible practice. Instead of seeing Ayurveda and modern medicine as opposites, the future lies in integrating both for better patient care. Thank you, sir, for sharing your valuable insights. Thank you to everyone watching. We hope this discussion gave you a clear perspective on Ayurveda. Namaste.
Thanks to Dr. Yashu for giving the opportunity to have this debate. And as a being an Ayurvedic doctor, if we come out of this debate, Ayurveda is pseudoscience, we'll definitely attempt to answer that one. I got an opportunity from your YouTube channel. I hope I have done justice to my debate. Thanks.